Dr. Neil McLeod, the man behind the vision of West Hollywood Dental. He founded the Los Angeles Burns Club, and he is presently serving as past president and in a mentoring capacity in Wildfire of Los Angeles. Welcome, Dr. McLeod, and thank you for being on the show.
Thank you for calling me. I appreciate it.
Well, congratulations. I understand you are the first recipient of the West Hollywood Doctor's Choice Awards in Dentistry in 2014. How does that feel?
Well, I was surprised and highly complimented to receive that particular award, particularly as my colleagues have voted for me to have that position. I consider it a great honor. Thank you. I hope
thank you.
I live up to the award and prove deserving of it.
Well, it is a great achievement. How long have you been established in your practice?
You know, I opened up my practice in 1976. I took over from Dr. Glazier, who ran the practice since 1929. It's one of the oldest practices in Los Angeles, and I'm the third dentist running the practice.
Wow. Well, that's fantastic. Well, we do know that it takes a lot of synergy and teamwork to make a successful practice, even when you've taken over. So we're wondering, what kind of a culture have you created in your practice?
Well, first of all, I have a wonderful team of supportive staff. And secondly, I have chosen a group of 8 other doctors with whom I meet every Tuesday for lunch, my colleagues. We're specialists in our various areas, and we just sit down to lunch and discuss anything that comes along, whether it's the increase in rent or a new dental technique. We meet and talk with each other every week. That is an enriching experience, and we share new ideas and challenges which come along together and reinforce each other's intention as we do that. It's really been helpful.
Oh, good. Well, you have received great reviews from leaders in the medical industry. How did you first get involved with Doctor's Choice Awards?
You know, I was solicited by Doctor's Choice. An email was sent to me, and I thought, this is one more way of increasing my cyber presence. In order to be successful in dentistry today, it's not just about how many patients you treat. It's about how many citations you have in cyberspace. Cyber buoyancy, the number of positive citations you have on the web, is critically necessary for any successful practice today. When the crawler engines search for a keyword that a searcher has entered, they're going to look for the most appropriate answer on the web. And if you don't have a lot of citations, your web presence won't be buoyant enough to lift your name to be selected by the crawlers. It's an automatic machine, it's an algorithm. And I looked at the invitation from your organization and saw that this was another way of creating a positive image for myself and my practice in Hollywood. And we're trying to do the best we can for our patients all the time. And getting the word out is most important. You were offering me that chance, and I took it.
Fantastic. Now, how did you get into the field of dentistry?
You know, I was studying sciences at Oxford, and my study partner had a brother-in-law who was a dentist. His name was Walter Pick, and he had a nice home and a pretty wife and a Jaguar XJ6 in the driveway, and time off in the evenings. He could come home. Now, my father was a soldier. He never came home. Here was Dr. Pick coming home every evening, and he had a color TV and nice deli sandwiches, which he offered us. I thought, maybe being a dentist is a good thing. Maybe I should ask him about dentistry. And I went down and saw his office, and he said, Neil, if you want to be a dentist, you should go to Guy's Hospital, London. And I applied to Guy's, and I got in. And that was the start. I didn't know that I wanted to be a dentist, but at least I was accepted and was very blessed to be able to get into the hospital to study.
Was that the specific moment you knew you were going to be a dentist?
I went for interview at Guy's, and at the end of the interview, they asked me, McLeod, do you have any questions you want to ask us? I thought for a moment and said, yes, sir. What grades will you ask me for to get into guys? And a wry smile crept across this gentleman's face. I didn't know it was the dean that I was speaking to. And he looked at his partners on either side, Dean Warner, and then he looked back at me and he said, we'll ask you for 3 Ds. Well, 3 Ds was not difficult to achieve. And I walked out of that interview knowing I was going to go to dental school. And that changed my life forever.
Fantastic. What advice would you give aspiring physicians regarding education and starting their own practice?
Right. First of all, never stop learning. There are continuing education programs which one needs to be taking to update your knowledge. We forget what we know. It needs to be refreshed. There are new techniques which are coming out with which doctors need to familiarize themselves. One never stops learning until one stops practice. That's the first advice I'd give. The next advice I would give is to make sure that you have an association with other colleagues that you respect and admire who can advise you, as we do with our regular Tuesday luncheons. That is so important. I also think it's important to have an alliance with either an academy or a dental school where you can have a chance of instructing others. You know, the word doctor means teacher, dictus from the Latin. And our job primarily is to teach our patients what their treatment options are so that they can make an informed decision about how they allow us to treat them. And that ability to communicate clearly has to be honed and refined. And you develop that by talking to other people and by instructing them. And I think that's really important. And of course, the third point about setting up practice is location. You need to choose to practice in a good place. I'm practicing in a city where there are many more dentists than the population needs, and we're crammed into small areas, so the competition is very steep. I mean, in the building where I practice, there are 53 other dentists. That is remarkable. So it's like practicing in dental Mecca. But it's still a good location, and I'm very fortunate to be able to practice on Sunset Boulevard at the edge of Beverly Hills.
And now you were talking a little bit about a gentleman who had referred you to dentistry. Is that your role model in dentistry, or do you have another one?
Oh, I have had a number of other mentors. My 3 perhaps greatest mentors were Dr. Harold Priestkell in London, whose house surgeon I was at Guy's Hospital. He recommended I go to America to study. And Professor Bernard Levin of USC, the University of Southern California.
Okay.
Bernie took me under his wing, and he helped me with my research articles and encouraged me to get them published. He really was the person who was responsible for getting me into the Pacific Coast Society for Prosthodontists and making me keen about wanting to pursue additional training. And then, of course, there was Peter K. Thomas, who was a private practitioner and teacher in Beverly Hills, who was well renowned for doing extremely fine quality work. And he inspired me and was a mentor. So those 3 men really are my mentors and my guides. And I always feel blessed to have had them teaching me. There was one other person who indirectly has always been schooling me. And that is Dr. Glazier, the man from whom I took the practice over in 1976. I still treat his patients, and I see the work that he put in their mouths as long ago as 1953. Work which looks as good today as it was the day he put it in then. And it is as though he's standing over my shoulder, watching over me when I see his work. Because I always ask myself, is the work that I am putting in my patient's mouth today as good as Dr. Glazier's is and was in 1950?
Fantastic. Well, tell us about a time that you had a challenge as a leader, that you had to face a challenge as a leader.
Well, one of the greatest challenges when people start to look to you for advice, and as you become, a more seasoned member of the profession, that happens a lot. The greatest challenges that I think can occur in practice are lack of income. Wanting to stick to your quality of your work and not compromising it, and finding out that patients have a hard time paying the high fee, or that practice is just slow because the economy is depressed. And under those circumstances, financial pressures occur because you have to meet your rent, your insurance, pay for your staff, your taxes. Those pressures can do more to destroy your enthusiasm and love for the work than anything else. And there have been a number of times in the recent past when I have been threatened, when there has been a decline in the financial environment. And those, I think, are the worst pressures that a doctor can endure in practice.
Okay. Well, that is all the questions that I have for you today. Thank you so much for doing this interview with DCA TV. Again, that was Dr. Neil McLeod, and I thank you again so much, sir, for joining us today.
It's a pleasure. Thank you.